A mid-range nursing theory assessment, the process of cultural competence in the delivery of healthcare services, a culturally competent model of care, by Josepha Kapina Bakati. Dr. Bakati is the president and founder of Transcultural Care Associates, a private consultation service which focuses on clinical, administrative, research, and educational issues in transcultural health care and mental health. She received her BS from the University of Rhode Island, a MS from Texas Women's University, a MA in theology from Cincinnati Christian University, and her PhD from the University of Virginia. She is board certified as a clinical nurse specialist in adult psychiatric and mental health nursing and a certified transcultural nurse. Dr. Bakati holds several adjunct faculty positions, and she is currently on faculty at Case Western Reserve in Cleveland, Ohio. She has been the recipient of several national and international honors and awards. A little background on Dr. Bakati. She is a second-generation Cape Verdean, which means she is of African and Portuguese origin. She began her undergraduate nursing back in the 60s during a time when the civil rights movement was going on, and it was at this time where she herself found herself not fitting into either group of her ethnic origin. And so that's when she began to explore the area of cultural and ethnic groups, and this was the beginning stages of her model. Dr. Bakati, after finishing her nursing degree, she also began studying culture groups in the field of transcultural nursing and medical anthropology. She practiced as a psychiatric nurse, which led to the field of multicultural counseling. And it's because of her areas of practice that she developed the culturally competent model of care, which blends the fields of transcultural nursing, medical anthropology, and multicultural counseling. During this presentation, there are 3 learning objectives. Number 1, to identify the major concepts of the culturally competent model of care, discuss how the culturally competent model of care affects change, and then how can the advanced practice nurse apply the culturally competent model of care to practice. The definition of this model is that it views cultural competence as the ongoing process in which the healthcare provider continuously strives to achieve the ability to effectively work within the cultural context of the client. The client can include individual, family, or community. And this model requires healthcare providers to see themselves as becoming culturally competent rather than already being culturally competent. There are 5 assumptions within this culturally competent model of care. Number 1 is that it is a process and not an event. Cultural competence consists of 5 constructs, that is awareness, knowledge, skill, encounters, and desire. The third assumption is that there is more variation within an ethnic group than across the ethnic group. There is a direct relationship between the level of competence of healthcare providers and their ability to provide culturally responsive healthcare services. And number 5, cultural competence is an essential component in rendering effective, culturally responsive services to ethnically diverse clients. As stated previously, there are 5 constructs to the culturally competent model of care. Number 1 is cultural awareness, which requires self-examination of the provider and in-depth exploration of one's own cultural and professional background. A cultural knowledge, which would be the process of seeking and obtaining a sound educational foundation about diverse ethnic groups. Cultural skill, which is the ability to collect relevant cultural data regarding the client's present problem, and then being able to accurately perform a culturally based physical assessment. Cultural encounter is the process that encourages the healthcare provider to directly engage in cross-cultural interactions with clients from diverse backgrounds. And then the desire is just the motivation of the healthcare provider to want to engage and learn more about the other person's culture, just becoming more culturally aware and knowledgeable and skillful in doing a culturally competent physical assessment. The cultural competent model of care consists of the 5 constructs, which, as you can see on the slide, it is 5 circular, interrelated, overlapping circles, and all of them cross each other. All of the 5 constructs will be addressed when you do a interview and an assessment of a patient. No matter where you may start off at, you will eventually cross all of these constructs. The intersection of the 5 constructs depicts the true process of cultural competence, and you can see that is in the middle there. And as the intersection becomes larger, the healthcare provider will begin to internalize the patient's constructs. So the object is to, as you become more culturally competent, that again, the process of cultural competence would become larger. And why is this important? Because we do live in a diverse world, and because it is multi-ethnic, it's important that healthcare providers are responding to meet the challenges of a multicultural world. And so you have to take all of these 5 constructs into consideration when you're doing a cultural assessment. Okay, for the case study I have and how I can apply this culturally competent model of care is a 52-year-old Hmong patient that has been living in the United States for about 10 years, and he speaks very little English. He presents to the clinic as a new consultation, and he's accompanied by his 16-year-old son who does speak English. The son states that his father has come to the pain management clinic because he hurt his back lifting a heavy object at work last month. The back pain has gotten progressively worse over the past 2 weeks. How can you apply the culturally competent model of care to this case study? Well, first of all, cultural awareness. You would be sensitive to this Hmong patient's healthcare beliefs and practices. The other thing that would be helpful in becoming culturally aware about his practices would be a handbook on various cultures as a resource, and this would help your cultural knowledge in regards to this patient. As far as cultural skills, because the patient's son is not an adult, he could not be used as an interpreter. He would need to be an adult, and he is not. So you would either need to get an interpreter to be there in person, or you could also utilize a interpreter phone, and that way you would be able to do a patient interview and assessment and provide the direct patient care. With this in-depth of a assessment that would be needed, it would be best that the interpreter be there in person. A cultural encounter is going on because the healthcare provider is there actually with the patient and doing an interview and doing an assessment. And the one thing you must be aware of is don't assume that all Hmong people are the same. And reason being is because there's a lot of variation within a cultural group rather than across cultural groups. So what you may have found in a previous Hmong patient may be different with this particular Hmong patient. So always keep in mind that even though they are of the same ethnicity, there still could be a lot of difference. Cultural desire is also being addressed here because the advanced practice nurse is trying to understand this patient and become more culturally aware. He or she would use interprofessional care and utilize collaboration with other healthcare providers, possibly PT or OT. Also, maybe even involve social work may be necessary just because he speaks very little English. Written information in his language where he could understand. We would need to get some materials for him so that he would be able to read it and understand it. Also involve his family in his care as appropriate, and then you're showing that you are engaged and you are caring, and because you are trying to address this patient's needs, and this allows the patient to feel of value. How can the advanced practice nurse apply the culturally competent model of care to practice? First of all, the advanced practice nurse must be able to perform culturally competent assessment on culturally diverse patients. And again, because we do live in a multi-ethnic world, you are going to come in contact with several different people of ethnicity. So it is important that you know how to assess them. Also, the advanced practice nurse needs to be aware of cultural diversity. When assessing patients and developing their plan of care, you need to understand their different beliefs as far as health care is concerned. And also, you must be able to intervene appropriately to provide the culturally competent care. Also, cultural competence is an essential component in rendering effective health care. And cultural competence model can be used in all areas of practice, whether it be in a clinic setting, if you're doing some type of research, policy development, and education. All of these areas of practice, you can utilize the cultural competent model of care because it encompasses all aspects of one's life. This has been Twyla James, RN, speaking on the process of cultural competence in the delivery of healthcare services, a culturally competent model of care developed by Josepha Kapina Pakati.